Recognizes Mr. Carter for 5 minutes.
Thank you, Mr. Chairman, and thank both of you for being here, and thank all of our advocates for being here. This is encouraging to see everyone here, and we appreciate it. As many of you know, I am a pharmacist by profession, and I have witnessed firsthand the outrageous cost of medications. I was the one at the front counter who had to tell the senior citizen how much their prescription was and watch them make a decision between buying their medicine and buying their groceries. I was the one who had to tell the mother how much the antibiotic was for their child and watch her in tears as she tried to figure out how she was going to pay for that medication. I made it my focus when I became a member of Congress 8.5 years ago to bring light to the problem that is in the drug pricing chain, and that is with the middlemen, with the pharmacy benefit managers, the PBMs, where we have 3 companies that control 80% of the market. With a company that is owned and with the situation that exists with the vertical integration where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor, and the problem that causes. And I just, you know, I've been singing that and bringing this to attention for ever since I've been here, and even before then when I was a member of the Georgia State Legislature. But now it's just not me. Now we've got the GAO, the MedPAC, OIG confirming these things, and it's been brought to the attention that PBMs bring no value whatsoever to the healthcare system. All they do is to raise prices. That's why I've got a bipartisan bill. It's called Protecting Patients Against PBM Abuses Act. You know, PBMs get charged or get compensated by charging fees that are calculated as a percentage of the cost of medicine, and this incentivizes the PBMs to increase the price of medicines and to blackmail the insurance companies for formulary access, and or blackmail the pharmaceutical manufacturers, I should say, for formulary access. And what this bill does is to delink the administrative fees paid by PBMs from the price of medicines. It also prohibits PBMs from reimbursing non-affiliated pharmacies more than they or less than they do for their own pharmacies. These are things that Representative Lisa Blunt Rochester and I, and she's on the other side of the aisle, these are the things that we put in this bipartisan bill. Dr. Hughes, will you commit to work with us on this critical piece of legislation so that we can protect patients and pharmacies from harmful PBM practices, and so that these advocates that are here with us today, that they can see some result in the lower drug prices?
Thank you, and thank you for that question. And certainly, we consider pharmacists to be trusted partners and just clinical leaders, particularly community-based pharmacists, as you note. We would definitely work with you on these proposals.
Right, but what we're trying to do is to lower patient costs, to increase patient care. All of us want the same thing, whether you're Republican or Democrat or independent. You want accessible, affordable, quality health care. It is not affordable right now because of what exists in the drug pricing chain. Mr. Dickin, as you're aware, your recently released GAO report found that PBMs are denying senior savings on medicines by not passing on their savings directly to the beneficiary. Understand that HHS didn't concur with your recommendation that CMS monitor the effect of rebates on insurance plans, formulary design, and on Medicare and beneficiary spending to assess whether rebate practices are likely to discourage enrollment for certain patients. What can you elaborate on this? Why would they not go along with that?
Yeah, well, thank you, and you're right that we did recommend that important first step is to monitor to see to make sure that there are not practices that may unduly affect or prevent enrollment by certain groups of individuals. Certainly appreciate that. You know, there are a number of changes. Some talked about this subcommittee today that are taking place, and we think that as CMS is continuing to implement a number of provisions of whether the Inflation Reduction Act or other things, it's important to really monitor to make sure that rebates are being.
But in your report also, Mr. Dickin, you found that plans exclude or disadvantage lower cost drugs due to various factors that are related to branded manufacturer rebates. What's going on here?
Yeah, that's right. That for kind of a group of very highly rebated drugs, the plan may give them preference, as you know it, on the formulary, even over other drugs that may be available at lower cost, either other brands or in some cases even generic.
Look, I practiced pharmacy for almost 40 years. I'm telling you, these guys, the Attorney General in Ohio is right. These are gangsters. They are ripping off the public. They're ripping off these people who are here today to advocate for lower drug prices. They are not bringing any value to the healthcare system at all. This is something we've got to address, and I hope I can depend on both of you to help me in this quest that I have to bring about lower drug costs. Thank you, and I'll yield back.
Thank you. The gentleman yields back.